to 79 years old in the Cayman Islands live with diabetes. 537 million adults the world over live with diabetes. November is World Diabetes Awareness Month. November 14th is World Diabetes Awareness Day, marking the birthday of Dr. Frederick Banting, the insulin co-discoverer. We, Rotary Central, along with the Health Services Authority, invite you to a free health screening: blood sugar, cholesterol, blood pressure, hemoglobin, A1C, BMI, and free physician's consultation. Saturday, November 4th, 10 a.m. to 2 p.m. Two convenient locations: A.L. Thompson's Georgetown, cost you less, Governor Square, West Bay Road. Mark this date that could change your life for better. Rotary Health Check, Saturday, November 4th. Rotary, creating hope in the world.
Radio Cayman's historical vignettes was brought to you by Rotary Central. For more than 110 years, Rotary members have used their passion, energy, and intelligence to take action on sustainable projects.
Now you can listen to Radio Cayman everywhere.
Everywhere.
Can you hear me now? Everywhere. Everywhere.
Yes, right from your Android or iPhone. Download the Radio Cayman app now on your Android or iOS phone.
The Radio Cayman app
is where you can listen to Radio Cayman everywhere you go.
Everywhere we go, we go. Everywhere we go, we go.
Find it in the Google Store, the Apple Store, or use the link at www.radiocayman.gov.ky.
Yes, now you can listen to Radio Cayman everywhere.
In answer to his question about the subjects.
There are more questions than answers.
Radio Cayman's Talk Today.
Oh, what a compliment. For that, I thank you.
What is happening now? There are hopeless and hungry.
Now it's time for us to stand up for God or we fall to nothing.
It's time now for Radio Cayman's Talk Today. If you're ready to talk, we're willing to listen.
Cayman Islands' foremost listeners participation program.
Radio Cayman's Talk Today.
Listening to the general public, what the public is saying.
Good afternoon, Cayman Islands. This is Kathy Miller. I'm filling in for Sterling Dwayne Ebanks this afternoon on Talk Today. And we've got a pretty busy day, a pretty full and informative afternoon for everybody that's listening out there. In our first portion of the show up until 1:30 p.m., I'm welcoming the Chief Medical Officer, Dr. Nick Gent, with the Chair of the Pharmacy Council, Mr. Kimani Blackwood, to discuss the Draft Pharmacy Bill 2023. Following that discussion, from 1:30 to 2 p.m., we will have the Health Practice Commission and representatives from the DCI, the Department of Commerce and Investment, to discuss the new procedures and how the HPC and the DCI are working together to streamline the process for those registering a business related to the healthcare field. So we're going to get right deep into the pharmacy bill right after these messages.
Talk Today is brought to you by Subway, open 24 hours in Countryside, Anderson Square in Georgetown, and Centennial Towers in West Bay. And by the Ministry of District Administration. Explore your history, explore your land, explore your sister islands. And Cayman Airways. Call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And now, Barbados. And Digicel, Cayman's bigger, better network.
Radio Cayman's Talk Today, the Cayman Islands' foremost listeners participation program. We ask our listeners to avoid statements or comments which are abusive, derogatory, malicious, or defamatory. Do not use any indecent language or make any statement which is false or misleading. Email talktoday@candw.ky or call 1-800-534-8255.
Courtesy of Live Communication.
Let your voice be heard.
Radio Cayman's Talk Today.
Good afternoon and welcome back to Talk Today. I'm Kathy Miller, filling in for Sterling Dwayne Ebanks this week. Tomorrow you will have OC with you on Talk Today, but right now you have me, and I'm welcoming our guests in the studio this afternoon, Chief Medical Officer Dr. Nick Gent and Chair of the Pharmacy Council, Mr. Kimani Blackwood. And we're here to discuss the Draft Pharmacy Bill 2023. Good afternoon, gentlemen. How are you doing today?
Good afternoon, Kathy. It's good to see you again, and
Thank you.
doing well, thanks. And I hope you're good.
I'm great, thank you.
Good afternoon. Thanks for having me.
Welcome as well. I haven't met you yet, so it's a pleasure to have you on Talk Today this afternoon to talk about a very important draft bill that we have, right? The Pharmacy Bill 2023.
Yeah, it's important. It can be a bit dry reading through it. It's not the most exciting of reads, but then again, very few laws are.
That's true. But it wasn't that hard to get through, I will say, because I did spend quite a few hours yesterday going through this and trying to understand, and I didn't get talking that kind of that lawyer speak. I didn't get caught in all of that. So I was quite happy. It was for me, it was pretty understandable. But then there's a lot of nuances I believe that are there that I don't fully understand, and that's what you guys are here to explain for sure.
Sure.
Right? So I believe that our former bill is from what's the year?
1979.
1979. Yeah. So that's pretty old.
Some time ago, and things have moved on quite a lot. And the way that pharmacists in particular, like my friend and colleague here, are regarded. At one time, it was a case of you went to the chemist to get a prescription filled, and it was rolling tablets, filling bottles, all that kind of thing. And it was a high street retail trade. But say my friend and colleague here, he's been through a lot of university time. He's extremely well educated. He is a health professional in his own right, and we need to make the most of those health professionals because they can add so much more to our care.
Absolutely.
Yeah. In the 1970s, what was required to be a pharmacist was maybe a diploma. A few decades before that, it was about an apprenticeship, working along with a physician, working in an apothecary, sticking on labels, counting. But since then, the profession has grown leaps and bounds. Now, in most jurisdictions, the minimum of an undergraduate degree, up to 5 years of training, including internship. We not only go into the dispensing process, but there is the clinical therapeutics aspect of it that is now required for pharmacist training. And so pharmacists over the past, I would say 20, 30 years have undergone what we would regard a paradigm shift. And so the service that pharmacists provide to the society on a whole is much more than just a process of dispensing, but it's now much more a holistic process of helping to manage the patient's therapy along with the physicians and other healthcare practitioners.
So that, as you've said, that industry for pharmacists has grown tremendously. There's a lot more, I want to say almost responsibility on behalf of the pharmacists.
Most definitely.
Yes. So for the Pharmacy Bill 2023, what are we trying to accomplish?
Well, first of all, we're bringing things up to date because there's some archaic bits and pieces that need taking out. And we need it to be framed in that modern context. And the context is always, with things like this, the highest possible levels of protection for patients and the public. We want the best standards. We want to make sure medicines are of the right quality, they're correctly described, they're dispensed properly, all the safeguards that need to be in there. We need to have a system which is responsive to us in Cayman being able to adopt medicines that we need to use. We don't currently have the ability to license medicines. We rely on other constituencies and say if a medicine is licensed by the FDA in the US, the Medicines and Healthcare Regulatory Authority in the UK, we'd say those are fit for use in Cayman. But sometimes we need to adopt medicines more quickly or in different contexts. And this is something that COVID threw up, that there were repurposed medicines, there were newly emergent vaccines, things like that, and we needed them quickly. So there's elements of this bill that allow for urgent and humanitarian needs, for instance. There are, aside from the safeguards, little things like, the information, they should be labelled in English. They should carry the information in English. We've had a lot of parallel imports in the last few years where medicines have come in and we're guessing what they are from the label because they're in Turkish or whatever. So we're saying, no, important safeguard is both the doctors, pharmacists, patients, nurses, we've got to be able to be certain. So there's lots of little funny detail that's been born out of experience. There's some elements that help to simplify personal import and travel medicines so that people don't get into trouble when they come visiting the Cayman Islands and so on. And
I want to ask Nick, you said I could call you Nick, right?
Yeah,
Comfortable
please.
with that, all right. So the CMO is cool with being called Nick, so I'm happy with that. Makes the conversation a little bit more easy. When you said you're getting some medicines that were, I guess, being labeled in a different language, what would you do at that point? Are you getting a translator, or do you have to reach back out to whoever exported it?
Well,
because that's very,
we can't
get that wrong.
We've got a lot of skilled linguists in Cayman, so we can often get translation. But even if we know we're more sure that that's the right medicine, the fact is, if it's a medicine that is being taken home by a patient, they've got to actually be able to go to the shelf and say, yes, that's the right medicine. They've got to, and importantly, medicines often contains, or should contain, something called a patient information leaflet, because you go to the doctor, you get told things, you come away. Generally, we think that people remember about a third of what they're told, and it's true, because you go in, you're ill, you might be in pain, you might be frightened. You don't take everything in those circumstances. So being able to get home and say, what's this medicine I've got here? But pull out the leaflet and be able to read it, and it'll tell you. And you might look at it and think, oh gosh, I forgot to tell the doctor that I'm actually allergic to, or that I'm on this medicine that it might interact with. It helps as another safeguard, as a reminder, and as a help to people. So yeah, it's really important. Simple things are the important things in the steps of medicines. It's about prescribing the right medicine at the right time. It's about giving the right information to the patient so they understand when and how to use it and what to look out for. It's about having a pharmacist in the chain who can check it and go back to that and say, hang on, I'm looking at all these medicines being prescribed here. I can see some interactions. I know this patient evolved because, we've been looking after her for 30 years, and I know that she has a problem with that kind of medicines and things like that. Continuity of care, and I say that final step of patient information so people can do the checks themselves.
And I'd just like to add something to what Nick, I think I'll take the opportunity to call you Nick for the next hour, but Dr. Gent was speaking about earlier. In 2011, when I landed in the Cayman Islands, two things I remember very vividly shocked me. One was, as soon as you arrive and having had experiences in other jurisdictions, you want to find out what the law is. So your first question is, okay, where's the Pharmacy Act? How am I supposed to practice? What is prescription? What is over-the-counter medications? How are controlled drugs managed? Now, I was working in a setting where there were different pharmacists from different jurisdictions, and everybody's answer was, I follow the laws from my country.
But those are the laws in your country. They don't necessarily pertain to Cayman at all. That's concerning.
But in the vacuum of not having having a legislation here that actually speaks to the issues, that vacuum has to be filled with something. Mm-hmm. And so one of the important reasons for us having a legislation that is up to date is to ensure that there is a standardized practice across the Cayman Islands that is fit for purpose for the Cayman Islands. We cannot transplant laws from the US here. We cannot transplant laws from the UK here because our particular set of circumstances are quite unique. And what they're able to do in the UK, maybe we're not able to do. There may be some restrictions that are in the UK that we may need to relax here because of our access, the fact that we're a small island. While there may be some things that are a bit looser there that we have to be more restricted about because we don't have the support to provide, if things go all right. The second thing was the fact that I took up medications and they were in a different language because that's not something I had.
Wow. Okay.
Yeah, that's not something that I.
This is so surprising to me.
Encountered, yeah.
Okay.
And so because remember, there are no restrictions regarding where medications can be ordered from. There are currently, in the absence of this bill, there are no regulations as to what the requirements are to ensure that this product is of a quality and a standard that is acceptable for the people of the Cayman Islands. And so we subsequent councils have spent hundreds of hours trying to work on getting this bill together. And in front of you, this is the culmination of all that hard work, along with the ministry and the support from the CMO.
Right. Well, I understand it's also something that's been brought up several times over the years. It's just never happened. So this is really our first draft since in full form since 1979.
Yeah, there's a lot of things around in the way we practice in the healthcare world that we've now got to take a good hard look at, given that we're growing as a country, and we're growing rapidly.
Yes.
So what could be done with less formality in the past now has to be tidied up, and we must be making sure that we are serving our patients as well as possible. And so this is just one of several areas where we're looking to get quality in the driven through, and making sure that we're making the best of the health professional skills that we've got. I mean, a really key one here is going to be that there's a provision in
Ooh, hold on to that thought. We're gonna make the people wait for that one. We've got to go to a commercial break, and I have to get the numbers for people to call, because I know some of them might be still not working. So during that break, I'm going to get the right numbers for everybody to call. And hold on to that thought, Nick, and we'll be back after these messages.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old gal.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Upgrade your connection with Digicell's all-new postpaid plans. Experience the freedom of endless local calls, more any-use data to browse, entertainment data for Netflix, Spotify, YouTube, and TikTok, and endless social data for WhatsApp, Instagram, Facebook, and Twitter. That's not all. Stay connected when you travel with roaming data for the USA, Canada, and the Caribbean, and make calls while abroad with more international minutes than ever before. Stay connected on the fastest, most reliable network. Make the switch today. Digicel, better connected.
Find your dream car with a Cayman National Vehicle Loan. Enjoy 100% financing, up to 8-year repayment, and a 7% fixed interest rate for the first 5 years. For eco-friendly cars, we'll waive your commitment fee. This only applies to new vehicles until December 31st, 2023. Call 949-8300 or email lending@caymannational.com today.
Cayman Islands, clear your calendars because something extraordinary is coming your way. Ignite the Fire, hosted by Christ for All Nations, is roaring into the Lions Center from November 29th to December 3rd. Join us for an epic worship and gospel event, a monumental move of God that will transform lives and reveal destinies. Don't miss this 5-night, once-in-a-generation experience. Be a part of history in the making. Ignite the Fire, Cayman. Mark your date, November 29th to December 3rd at 6:30 p.m. nightly, and get ready for an unforgettable spiritual journey that will set your heart ablaze. Cayman and you will never be the same again.
Wouldn't it have been grand if you had purchased land 30 years ago? It may not be 2020, but a perfect vision has never been more clear. Cayman Brac and Little Cayman, poised for growth with an eye on the future. Your land, your history, your future. Discover all that our sister islands have to offer.
Listening to the general public.
The Cayman Islands' foremost listeners' participation program.
Radio Cayman Talk Today.
Because
there are more questions than answers.
Waiting to take your calls right now.
What the public would say.
Welcome back to Talk Today. I'm Kathy Miller, filling in for Sterling Dwayne Ebanks this afternoon. And on this segment of Talk Today, we are discussing the Pharmacy Bill 2023 with Chief Medical Officer Dr. Nick Gent and Chair of the Pharmacy Council, Mr. Kamani Blackwood. And just joining us in the studio as well is Miss Janet Flynn. She's a Senior Policy Advisor with the Ministry of Health and Wellness. So good afternoon, Janet. You've just joined us.
Good afternoon, Kathy, and good afternoon to your listening public.
I hope you were able to hear a little bit of the beginning of the interview.
Unfortunately, no.
That's okay. We were just discussing really what the bill is trying to accomplish. And right before we went to break, Nick, I know I said, hold on to that thought, because you were talking about some new provisions, I believe, that are in the pharmacy bill.
One of the ones that I'm most excited about, because my level of excitement is not always everybody else's. There is, say it is a bill, and it's out there for consultation, for people to come back to us and say what they like, what they don't like, what we've missed out, and all that kind of thing. But one of the ones that's put in there is that traditionally, the only people who can prescribe medicines in the Cayman Islands have been doctors, dentists, and veterinary surgeons. And we've got a provision in there to say that we can make regulations for other classes of healthcare workers to be able to prescribe medicines. And one of the first groups I'd like us to be able to give those rights to are the pharmacists, because we had that lovely presentation from my colleague there at the beginning was telling you about the evolution of pharmacists, right, and how these people have become now such skilled professions in their own right, and we would generally refer to them as clinical pharmacists because they practice medicine too. But here in the Cayman Islands currently, there's that what I think of as an artificial limit on what they can do, and I've been used to working with clinical pharmacists who take very active roles in managing patients for some 20 plus years, and I know that not only is it a good thing and a safe thing, but it opens up a lot of particularly long-term care management to a group of people who are very skilled at doing that. So, for example, if you've got a long-term care condition like high blood pressure, you've got diabetes, things like this, pharmacists are in a fantastic position to do that. I firmly believe everybody who's taking medicines should see a pharmacist at least once a year to have all their medicines reviewed, because pharmacists are brilliant at looking through things and saying, hang on, that's not going to mix well with that. Don't need that if you're taking that. Simplifying the medicines down so that only the core medicines that are needed are being taken, and so there's less risk of interactions. Pharmacists are great at doing things like all the travel advice, travel medicines, travel vaccinations. They're great at doing things like the seasonal vaccines on. There's a lot they can do, and many pharmacists I know have grown to be pharmacists and health practitioners in very specialist areas. And that to me is one of the most important things, because that we might get out of this bill, because it'll make a group of skilled clinicians very accessible. And sometimes we've got people in the Cayman Islands that don't have good access to healthcare professionals for one reason or another, but it just opens another door for them.
Okay, so Kamani, can you touch on that, because you're speaking on behalf of the Pharmacy Council, correct?
Yes, and one of the great things that I marvel about, and I'm marveling while sitting here, is that we have a CMO who is so experienced and is in a position to speak about pharmacy as if he's a pharmacist. He's representing well. So there's very, very little for me to say, except that the pharmacy profession, as I was speaking about earlier, there are many persons on the island who, having done an undergraduate degree, have gone ahead, done a doctorate in pharmacy, masters in clinical pharmacy. We have persons across many other jurisdictions, including UK, Canada, and some of those persons come here to work who are trained independent prescribers and are licensed so to do. In, for example, the UK, we currently have on the island pharmacists who, in a formal or informal setting even, are diabetes educators who, work in clinics. One example is Ms. Winsome Jefferson from the HSA, who has a clinic where patients are scheduled to come in to see to see her. Physicians refer patients to her, and those patients are assisted on their journey to reach their goals. And she has been getting very, very good results, and very good feedback has been coming. So there are a litany of roles from a clinical management standpoint that pharmacists are trained to pursue that will benefit the patient. There are many patients who, in between their doctor's visits, need those questions answered, need those problems solved. And sometimes they range from as simple as this medication is out of stock, I can't get it anywhere, so I don't take anything at all. And in 6 months, my HbA1c, the marker for how well your diabetes is being controlled, is sky high. While if there's a pharmacist who is accessible each month for those 6 months before your next doctor's visit, then an intervention can be made to say, okay, this one is out of stock, but there's another medication in the class that we can have you switch to until we get this particular medication in. And I'm giving this as an example of something that we actually do. And it could range from as simple as that to as more complicated as there are particular parameters that are completely out of whack. And a conversation is had with the patient and with the physician, and recommendations are made about changes in the approach to therapy. And those changes, are made by the physician, ultimately made by the physician, and the patients have better outcomes. So there is a role to play. It is happening all over the world. It is happening here in small pockets and almost in an informal way. And what this legislation will help to do is it will help to regulate that and reinforce and promote it so that it can be of benefit to the people of the Cayman Islands.
So to be clear, with pharmacists now being able, according to the Pharmacy Bill 2023 draft, pharmacists will be able to prescribe medicine.
Yes.
Will that replace a doctor saying, hey, the doctor has to give the first step in the prescription? Will that replace the doctor altogether?
What you usually do when you pass this kind of legislation is that you make it by regulation, so that we can stipulate the training and experience, because we'll have some pharmacists on the island who have never had training in prescribing, but we'll have to provide that. And usually you provide a formulary. This is the pharmacist's list of medicines that they can prescribe. And it includes initiating treatment as well as modifying treatment as you go through. So the key thing here, and Garni put this over so well, is that this is about allowing people to work together, because multidisciplinary teams make better clinical decisions. Each one has their own valued role, but the ongoing care and management, once the diagnosis has been made, needs to be handled by lots of different people. And life gets more complicated as you get older, as I'm finding out. You acquire more aches and pains and bits and pieces of this, and so it's often been said, and it's often been demonstrated, that the most harmful part of clinical practice is misprescribing and what we call polypharmacy. That's where medicines are just added on top of other medicines, and so there is not rational care. And so as people go through, they might have a hospital doctor, they might have a GP, they might be seeing a nurse specialist for something else. Pharmacist as somebody holding that ring in the middle and making sure there is no harm and the clinical benefit is maximised is good. This provision, though, although we set it in the context of pharmacists, potentially opens the door for other clinical practitioners to use prescribing rights. So, for instance, around the world we have some very highly specialised nurses with a lot of postgraduate training and experience, and it may be that some of those can come forward. It also helps you to develop things like your emergency medical technicians, because it allows you to put more pre-hospital therapeutics in their hands. So it's a tool that we can use to help bring clinical professionals on over the next generations.
Okay. I think you kind of answered a follow-up question I had there, but what I want to ask is there a limit to what the pharmacist can prescribe?
Usually what we'll do is, and this should be for every health profession, but believe me, you've got to know your limits.
Mm-hmm.
I mean, there are things that I wouldn't, in theory, I've got a license to allow me to prescribe anything I want in the Cayman Islands, but I'd be very careful that I was within my scope of practice, as we call it. And similarly, defining the scope of practice for pharmacists or any other healthcare professional that's brought in is going to be important, and then providing a formulary which says, and these are the medicines that are suitable for the scope of practice. So there's an awful lot of work behind that needs to go on if everybody's happy with this provision in the bill.
Okay, excellent. We're going to go to a commercial break right now, and I want to let everybody know that we will be taking phone calls. I had to get a little bit of this information out first without any phone calls coming in. But if you'd like to give us a call, if you have any questions about the pharmacy bill, the discussion will continue till 1:30. Do give us a call at 949-8037, 949-6990, or you can WhatsApp us your questions or comments to 925-3261.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I go and flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old gal.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Discover your dream home with Cayman National's home loan. Get up to 95% financing, repayment up to 40 years, and just a 0.5% commitment fee. Your interest rate? Depending on your risk factors, it'll be fixed or variable. Plus, you get a pre-approved credit card. This is a limited time offer. Dial 949-8300 or email lending@caymannational.com today.
They say variety is the spice of life. And that's why at Subway, we're introducing the new Boneless Hot Sub. Say what? The premium sub brings new ingredients like spicy breaded boneless chicken, French's crispy fried onions, and buffalo wing sauce, bringing a zesty and flavorful experience with every bite. Add some of your favorite veggies, cheese, and ranch sauce of your choice of freshly baked bread for the ultimate boneless hot sub. For a little spice in your life, try the new Boneless Hot Sub from Subway.
So good and tasty.
And make it a meal with a drink and chips or cookies. Subway. Eat fresh.
Avoid contact with standing water and floodwaters during and after a storm to prevent exposing yourself to serious health risks, including infectious diseases, chemical hazards, and injuries. As an added precaution, your emergency kit should also include personal safety equipment such as rubber boots and gloves. For more useful hurricane preparedness tips, visit the Water Authority's website at www.waterauthority.ky or follow us on social media.
Introducing Digicell's all-new prepaid plans. Packed with more any-use data than ever before. Entertainment data for the apps you love, like Netflix, Spotify, YouTube, and TikTok. Plus, endless social data for Snapchat, WhatsApp, Instagram, Facebook, and Twitter. So you're always in the know. Stay connected. Stay entertained with Digicell's new prepaid plans. Activate in the My Digicel app today. Digicel. Better connected.
The Buddentown community is invited to a meeting at 7 p.m. on Thursday, October 26, to hear about the updates on the completion of the hurricane shelter. The meeting will be held at the Church of God Chapel, Buddentown. That is Thursday, October 26 at 7 p.m. at the Church of God Chapel in Buddentown.
to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
Good afternoon and welcome back to Talk Today. I'm Kathy Miller, filling in for Sterling Dwayne Ebanks, who, by the way, is supposed to be on vacation but is listening to the show and has sent a question in. So, Dwayne, yes, I did get your question and I will be asking. We are discussing the Pharmacy Bill 2023 in studio with Chief Medical Officer Dr. Nick Gent, Chairman of the Pharmacy Council, Dr. Kamani Blackwood, and Miss Janet Flynn, the Senior Policy Advisor in the Ministry of Health and Wellness. So to ask Dwayne's question, he's saying, what about allowing clinical psychologists at the doctoral level to also prescribe medications as some other jurisdictions allow?
Yeah, definitely on my list, Dwayne. Along with community psychiatric nurses. Very often these are people who are very good, not necessarily just at prescribing medicines and understanding them, but adjusting, because quite often adjusting the doses of frequency and doing the associated checks for some of the medicines is very, very much in their remit. And yes, Dwayne, you are supposed to be on holiday, not asking us questions. I hope you're managing to read War and Peace as recommended. And I'll be asking about the synopsis of that when you get back in the studio.
That does seem like a heavy read, though, for the holiday. So I know we touched on it a little bit about why this bill is needed, but Ms. Janet, I don't think you were in when we did kind of talk about that. So coming from the policy side, from the Ministry of Health and Wellness, can you speak as to why you think this bill is needed?
So, Kathy, first and foremost, you can see that this is an old piece of legislation, 1979, over 40 years old. So that speaks for itself. But in addition to that, just based on the conversation that I've heard since joining the team here, the whole issue of prescribing rights that Dr. Gent has spoken to in terms of expansion of that, you can see that there are several advances in pharmacy practice over the years that we need to certainly include in the next piece of legislation, the next round, and that's what we're aiming to do. The whole importation of drugs, looking at the counterfeit, there's an increase in that all over the world, not just in the Cayman Islands. So those are some of the issues that are currently not addressed in the legislation, and we wanted to make sure that pharmacists, they have a duty of care to the public. And that is what is first and foremost, to protect the public. So this piece of legislation will aim to do just that and more.
Okay, thank you. Dr. Gent, Nick, you were talking about some of the key changes, right? We talked about, well, what we really mostly hit on basically was that pharmacists are going to be able to now prescribe medications. What are some other key changes or updates to this bill?
I think we're going to try to... because there'll be regulations that follow the bill, so processes, consultation, then any amendments to it, then any redraftings, then it's got to go to Parliament. Long processes here. Parliament debates it. If Parliament are happy, they pass it with or without amendments, and then we need to get into the process of regulations. And so I think simplifying down what we're doing in terms of things like medicine that has to be prescribed, which is then dispensed under the supervision of pharmacists. Things which pharmacists, irrespective of prescribing rights, can sell directly to the public, and what those medicines are. They're sometimes called, pharmacy-only supply. And then also looking at what medicines it's safe for the public to buy just simply from any shop. Going to the supermarket, off the shelves, going to the corner shop, whatever. And so defining all of those things, because it's a little while since we last looked at those lists. And, because there are many things out there that are safe for people to just buy off the shelf and use. But what we think of as safe and now, and what we was safe before, those things have all changed. So that's there.
Do you have any examples of what are on the shelves at the gas stations or supermarkets, but maybe aren't necessarily safe anymore for the public to take to medicate themselves?
They're pretty good at the minute, I must say. I'm thinking more about there being more medicines available rather than things that are out there being unsafe. But if you wanted an example of a medicine which has changed completely, when I was a kid, if I got a headache or I've got flu-like symptoms, my mum would give me aspirin.
Right.
I wouldn't give a child under 18 years of age aspirin now, because it's been associated with quite rare but very nasty complication called Ray's syndrome. So things have changed. The number of painkillers that we used to use for children, we probably wouldn't want to use in children in the future. There are a number of other things, though. We might we might be looking, especially in terms of pharmacy oversight, things like some antibiotics, antivirals, things like that. I say, bearing in mind you've got a really good skilled group of people there to give advice. Because remember, when you go to a pharmacy, and one of the critical things we're setting out this bill is, you're not going to a shop that sells medicines or supplies medicines. You're going there for expertise. And so there are other medicines that I think, that sold under the supervision and in consultation with the duty pharmacist, that we can probably make a bigger group of those medicines than we have in the past.
Okay. I think one of the major things that I've seen in the bill was Cabinet's ability to authorize emergency use of non-approved medicines for certain occasions. For example, the COVID-19 pandemic, when that happened.
Yeah.
Can you speak on that? Because that seems pretty serious to me.
Well, we've got two classes. One is urgent use and the other is exceptional use. And the urgent use is something for Cabinet that where we need a class of medicine to be available to everybody in the Cayman Islands. But also the Pharmacy Council and Kahani here will have exceptional use provisions so that they can rapidly allow the use of medicine. Very often it's something also called humanitarian use. So, for instance, you get somebody who has got an unusual disease, it's potentially life-threatening, and the medicines that we know that might use are still only research or repurposing medicines from one disease to another disease. And so Kamani and his team can look at those and then say, yeah, we think that's justified in those circumstances, and grant that use. And we've had sort of bits and pieces of provisions in a number of different acts, but this really consolidates it and makes it very clear that the council can act for urgent need at the individual level, and Cabinet can take decisions quickly about medicines that we want to take the responsibility for us being able to list as being available for patients in the Cayman Islands ourselves, not depend on some other constituency like the UK, granting a license, us saying, we've grown up a bit. Mm-hmm. We don't have things like I forget how many people work for the medicines regulator in the UK. It's probably a couple of thousand. We don't have that resource. But for some things, I trust Kaman's judgment, and I trust the judgment of his colleagues.
And just to harken back to what the thought process was behind these caveats, and it is, we want to ensure that we specify jurisdictions from which we may import medications, because we want to be able to look at the infrastructure that exists, the regulatory framework that exists, for example, an MHRA or an FDA from the UK or Health Canada from Canada. We want to ensure that the jurisdiction that we are importing medications from, or medications that have been registered in that particular jurisdiction, we want to ensure that they not only have the system set up to ensure the quality of the medications, but that they have systems set up to continue surveillance of those medications, to ensure that the medication that you made, that we authorized and we registered in 2010, that in 2030 you still have the same standards and you are still manufacturing the medication that met those particular requirements in 2010. And so once we depend on those particular jurisdictions, we have one section completed, and however, there are going to be situations that are unique to us. We may have an epidemic on the island that does not exist anywhere else. And there may be medications that can save lives that we need to urgently get in. We can't depend on whether there is a registration in these jurisdictions to go ahead. So we ensure that there was this caveat in the legislation, which would then allow the cabinet to act very swiftly to get well-needed medications in. On the other hand, the other caveat here is the exceptional use authorization. And it is where there are medications that may not be registered by these jurisdictions, but physicians and prescribers here find useful, find safe to be used in their patients, and can make a request to the Pharmacy Council for it to be considered and approved. So what we've done is ensure that we have a conduit through which we can get registered medications from established jurisdictions, but at the same time we have not locked ourselves into a corner where if there are emergencies or situations that come up where we need to step outside that we're not able to do it under the law. So that really was the thinking behind these alternative methods of getting medications in.
Okay, thank you for explaining. That is one of the key changes and the updates to the Pharmacy Bill 2023. We have to go to the 1 p.m. news headlines right now. So the news headlines, a little commercial break after that, and then continue to join us in the discussion. And don't forget to call us at 949-8037, 949-6990, or WhatsApp your questions and comments to 925-3261.
Satisfaction is guaranteed 24 hours a day, whether it's music or information.
From Grand Cayman to Cayman Brac to Little Cayman, we've got you covered.
You ever hear a thing like that?
Radio Cayman in the Cayman Islands.
Today's biggest news.
Radio Cayman, your voice, your choice.
Local, regional, international. This is Headlines from Radio Cayman's newsroom.
Today's biggest news.
The headline news is brought to you by Health Services Authority and the Ministry of Tourism and Transport.
The Cayman national women's side is back in action as they take on Curaçao here at home on the road to the CONCACAF Gold Cup. In the first match of the Gold Cup series against Anguilla, Cayman drew 2-2 in Anguilla. In the second game, Cayman defeated Anguilla 3-1 at home in Cayman. Now for the third match, Cayman will play Curaçao in the CONCACAF Gold Cup qualifier this Thursday at 3:30 p.m. at the Truman Bodden Sports Stadium. After Thursday's matchup against Curaçao, they will get another shot at the visiting side on their home turf on Monday, December 4th. Good afternoon, I'm Dion Anglin with your headlines in news elsewhere. U.S. media are reporting that the Biden administration is asking Israel to delay the ground invasion of Gaza in order to buy time for more hostage negotiations. The release of 2 American women held captive by Hamas late last week have spurred efforts to more urgently negotiate the fate of more than 200 other hostages. A number of other U.S. citizens are among them, and the U.S. Secretary of State Antony Blinken said at the weekend that the U.S. was making non-stop efforts to bring them home using whatever devices, partnerships, relationships they have. And scientists say they may have made the biggest breakthrough in treating cervical cancer in 20 years using a course of existing cheap drugs ahead of usual radiotherapy treatment. Trial findings revealed at the ESMO Medical Conference show the approach cut the risk of women dying from the disease or the cancer returning by 35%. Cancer Research UK, which funded the work, called the results remarkable and said it hopes clinics will soon start doing the same for patients. That's a wrap of your headlines. I'm Dion Anglin.
Today's biggest news.
Radio Cayman, your voice, your choice.
Local, regional, international. This is Headlines from Radio Cayman's newsroom.
Today's biggest news.
The headline news is brought to you by Health Services Authority and the Ministry of Tourism and Transport.
It's one of the best moments of your life when you welcome your baby into the world. The HSA's Experienced Women's Health and Maternity team provides the highest quality of care throughout your pregnancy and delivery. As a JCI accredited hospital, we are the leader in maternal care, safely delivering over 700 babies annually. Visit hsa.ky for more information. At HSA, we are committed to caring for you.
I am Teresa Pitcairn, the chairperson of the Cayman Islands Beautification Task Force. Derelict vehicles are not only unsightly, they also lower the quality of life in our neighborhoods and pose serious public health and safety risk. To report a derelict vehicle, please call the Department of Environmental Health on 949-6696.
Be a part of the solution, not the pollution. Littering is a crime punishable by a $500 fine or 6 months in prison. Brought to you by the Beautification Task Force and Ministry of Tourism and Ports.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Born in Creek, Cayman Brac on the 25th of September 1939, Henry Mansfield Connolly was the third of 8 children for Henry Kitchener and Olive Connolly. As with many of the men of his generation, he went to sea at the tender age of 15 and worked for Mr. Southwell and National Bulk Carriers for some 30 plus years. During this time, he rose from being an oiler pumpman to the post of second engineer after completing correspondence engineer courses from a school in New York. He sailed on many ships, including the Universe Leader, Universe Defender, or Titan, or Venus, or Meteor, or Transport. After his tenure at National Bulk Carriers, he was one of the few Brackers who worked with Cayman Energy Company doing the ship-to-ship oil transfers off the island in the 1980s. After a medical injury, he retired from sea and started his own plumbing engineer company, C&H Plumbing.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Explore your history. Explore your land. Explore your Sister Islands, the ultimate staycation experience. Your culture, your freedom, the land that time forgot isn't gone. It's your Sister Islands.
Discover all that our Sister Islands have to offer.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
Good afternoon and welcome back to Talk Today. I'm Kathy Miller, filling in this week for Sterling Dwayne Ebanks. I have in studio with me this afternoon the Chief Medical Officer, Dr. Nick Gent, and the Chair of the Pharmacy Council, Mr. Kimani Blackwood, as well as Miss Janet Flynn. She's a Senior Policy Advisor in the Ministry of Health and Wellness. We are discussing the Pharmacy Bill 2023, and during our break, we did have a question come in, so I do want to address the question before we go back to talking about what some of those key changes and updates of the Pharmacy Bill 2023 are. Now, that question coming in, I won't reveal the person this time to our listening audience, but in studio we know who asked this. So, is this bill linked in any way to warnings issued by, say, the FDA, the Food and Drug Administration, or other international associated bodies?
Good question. It doesn't explicitly deal with that, but we do have a good system of communication with our professionals, and where we do see, say, a medicine being particularly new medicines having adverse effects or new contraindications, then we fortunate that the clinical community in the Cayman Islands is small, so getting that information out to them and giving them warnings is relatively simple to do. Not seen the need to do that in the whole 12 months I've been here so far, which seems to have flown by. But I'm sure Kimani and Janet may very well have had experience of doing that in the past.
We have in the past had cases where, for example, there were recalls and had ensure that all stakeholders are informed and that the steps that are necessary to get those medications in, medications that were found to have carcinogens, and then the FDA makes, gives a notification about it and, asks for the medications to be brought back in. So we have, had situations like that. But for the past 12 months, I think we've been pretty okay.
We've been good, yeah. But we do keep an eye on anything. I mean, there's interesting things like safety of cough medicines in Africa and India, where there's been contaminations. We do a lot of intel of keeping an eye on what's going on elsewhere.
One thing that has happened recently, there is a pharmacy that intercepted counterfeit Ozempic.
Yeah,
yeah.
Good example.
Ooh,
yeah,
locally.
Yeah. It's a quite popular medication over the past year.
It's a diabetes medication.
Diabetes medication,
not a weight loss. Just put that out there.
Don't get us started.
But if you Google Ozempic counterfeit, there's a long list of articles from Reuters, from the BBC, CNN, Yahoo, all over, identifying that there is an issue that is raising its head. Germany, UK has intercepted Ozempic in their market. The US, they've also intercepted counterfeit Ozempic. And the manufacturing company, Novo Nordisk, they have actually sent out, just guidance regarding the counterfeit medications that they're aware of and what to look out for. And the ones that were intercepted here, again, unfortunately, they were not in English. So it's an issue that...
that was a sign.
Yeah.
Okay.
It's an issue that I know that going forward with this regulation, we will be in a position more equipped to be able to handle in a proactive way, and to also be able to identify sources and hold sources accountable because of the requirements that we will be going forward with.
Because naturally, my question is, how do you really test to make sure that medicine is that approved medicine that's coming in, it's not counterfeit?
Well,
what steps do you have to go through?
Well, one of the things that is well known and is practiced in most jurisdictions in the Caribbean and the developed world is that the supplier must be able to prove that the source from which the medication is coming, that is the original source. And so licenses, market authorizations are provided. So only certain suppliers are authorized or licensed to be able to source that medication from the manufacturer. So one of the key tenets of ensuring quality medication supply is ensuring that from the position of the raw material to the finished product is traceable. And that is one of the reasons we have to do what we do, because currently our pharmacists individually, based on their professionalism, try to do that by themselves. However, having that regulatory framework in place to do those checks and balances to make sure that when the drugs are coming in, we have that information that indicates from the point of the raw material all the way through to how it was transported. If it's a cold chain product, how was it stored? Was it transported at the temperatures that it's supposed to, or was there an excursion? All that needs to be looked at. It's not only about if the medication is original. It's also about if it is to be stored between 2 to 8 degrees, was it stored at 30 degrees?
Right.
Because that may render it useless.
This seems very important to me because, as you said, the current framework, it's more so up to the pharmacist to make sure it's okay, but there's no actual regulatory framework for them to follow all these steps to ensure medicine isn't counterfeit, which to me would, if it was and somebody's prescribed it, to me it would seem that there's going to be some legal repercussions towards the pharmacist.
Well, there are many discussions over the years regarding that, but we have to ensure that the pharmacists are protected because everybody is trying to do their best and everyone is using the information that they've gleaned from their training, and that the laws, as I said, wherever there's a vacuum, wherever there's a gap, you have to fill it with what you know. Mm-hmm. But then many persons are filling it with different things that they know. So right. I can say that we are in the position that we are today where we don't have abject chaos. Mm-hmm. Because of the professionalism and the ethical stance of our pharmacists, where over the years have tried their very best to ensure that we can verify where things are coming from and so on. But
this is like an added protection for them as well,
mm-hmm.
which I think is a great benefit as well for pharmacists, not just patients being prescribed medicine. Any other key changes? I think I thought, Janet, you were going to mention more.
Yeah,
yes.
I was going to touch on the whole approval process, licensing process for importation. If you need a manufacturing license, a dispensing license, everything now has to go through the Pharmacy Council. For drugs or medicines, I should use that word instead of drugs, medicines.
That's right.
Medicines that are already approved in another country, which Kimani spoke to, then those automatically would be approved by the Pharmacy Council. So that process, that licensing process would not be necessary because it would have already had what is called a market authorization. One other thing was also the fact that we've now...
Can I interrupt you on that point?
Sure.
Because, and I'm not sure if you can answer this, but I hope, Nick, you can as well. So going on that point, so a medicine might be approved in the U.S., but not in the U.K. So does Cayman follow strictly, would it be the USA's FDA for approved medicines or the UK's MHRA on approved medicines? Like if something's absolutely not allowed in Europe or the UK, but it is approved in the US, and we know that there's instances of that, I cannot say what they are off the top of my head. How do you make those decisions?
It's either or. It just needs to have a product license in either the US or the UK. Or one of a number of other constituencies where we are satisfied that the regulatory framework is good. And the reason for saying either or is that the demand and therefore the steps towards licensing run at different rates in different countries. So something might come to market first in the UK because there's a European demand for something, or it might come first in the US. But either one, as long as it's from a trusted authority, we're happy with that.
And if there's evidence, however, that there's a particular medication that may be harmful to the public, then the CMO would have to consider if this medication is fit for public health, from a public health standpoint. And so a decision might be made that, well, we may have to hold off on this particular medication. So, but the initial understanding is that once it is approved in any of the jurisdictions that will be stipulated by the regulations, then that would be an initial approval.
Okay, thank you. And sorry to interrupt you, Janet, if you can remember.
That's okay. I think we probably already have some of the countries that we're contemplating to introduce in the regulations, So as CMO said, it's either or. One other thing is talking about the leaflets in medicines that must be in English. Because our understanding is that right now there are medicines that are imported without any form of English insert, whether it's a prescription-only medicine or a pharmacy-only medicine. So that is now stipulated in legislation that the inserts must be in English, written in English. That information is for the patient.
Right.
Then we also talk about, Doc, you wanted to?
I was just going to say, if you could touch on generics.
Yes, I was just going to touch on that. Thanks, Doc. So there's a provision talking about interchangeable medicines. I can't remember, clause 27, interchangeable and bioequivalent generic medicines. And that's a practice that has already been established, where pharmacists will offer a cheaper option, but with same efficacy, same quality as the brand name, but it's a cheaper option for the patient. And like some patients who only have SHIC and, their medication benefit is not as adequate as it should be. And so the law now is legislating that the generic equivalent must be offered to the patient as a first, unless the doctor indicates otherwise.
Okay.
That the prescription says brand name only.
Okay.
Currently, most of the doctors will say generic substitution allowed. And so it's, like I said, it's already an established practice pretty much, unless a patient insists, I only want brand name. So those are some major changes. That's you. You always
that was me once. When I had to go through I had several surgeries on my wrist years ago, and it was about getting certain pain medicine. I absolutely requested Percocets. That's my example. And my one doctor was like, he wrote something else, and I was like, that doesn't say that. Not that I could really read what he was writing. And he was like, this is the generic version. And I didn't quite know what that meant. But as soon as I even mentioned that this is what I got, I will say that I was offered by so many people at least $50 a tab. for me to sell my medicine to them. Yeah.
Really?
So there's I understand there's also a big abuse of and misuse of medicine in the Cayman Islands when it's being prescribed to people. So that's a big problem. We've seen that problem, especially in the U.S. How that's grown. How will this bill kind of help? I want to say, help affect positive change with that. So there's going to be less abuse. So hopefully we'll be seeing less of that, because I can go to a doctor and say, I've got a problem. I'm feeling pain like this, and they might just kind of write me off in a sense. Okay, they'll listen, they'll write a prescription, and I'll get all these medicines, but I might be doing something else with it. And then how do we address that problem? Because it is a growing one.
Yeah, this bill won't do that directly, but there are other things that we are doing to try to manage those, introducing standards of how things are prescribed and dispensed if they are addictive medicines, for instance. Looking to put in systems so we can monitor the change in use, so we can understand which medicines we need to be most careful about. But I know there's also something else that I know Kamani and myself are really, really keen on at some point, and that is that we have an electronic pharmacy system, a secure electronic pharmacy system. And this is, you go and see your doctor or whoever's got the prescribing rights, and you don't get a paper prescription. You get your prescriber says, where would you like to collect your medicine from? You tell them which pharmacy you want to collect them from, and they order that medicine on a secure electronic link from that pharmacy. But those kind of systems do far more than just offer the security against potential misuse. They offer you the ability, for instance, that the medicine's record's there, and you type in the name of the medicine, and there might be a big red flag. Do you wish to continue prescribing this medicine? Are you aware it may interact with X or Y or the patient's past allergy record? So that you can, safeguarding, medicine errors are the biggest avoidable issue of harming patients in the world. So I know we're really keen on having that, the safety, the security, the added quality in terms of being able to manage that patient safe. But also it makes that thing I talked about, medicines management, which is it's a bit of a term of art. It's it means something to three of us sat around this table, but that's that once a year, twice a year review. Are these medicines all needed? Are any of them interacting? Are they at optimal dose? Do there needs to be any tests done in order to make sure that the levels are right, or there's no problem with this medicine causing harm to, say, the kidneys and so on? Once you've got that kind of a system in place, you can offer a much, much better safety environment for people. You can offer a secure way of managing the medicines, and you can get an understanding also about, because that for instance, the prescribing of medicines for, say, diabetes, it gives you a handle on understanding the chronic diseases and being able to plan the care that people in the Cayman Islands deserve.
Right, which is very, very, very important. And for the record, I didn't sell any of my pills. I put that out there. No, not at all.
You just caught me pursing my lips a little bit, didn't you?
How can the general public provide feedback on this bill?
So, feedback has already started to come in, and we really thank those persons who have already responded. And very positive, constructive feedback has begun to come in, which is very good, very good. That's a positive sign. But feedback can be provided on mohfeedback@gov.ky. So you can send your comments to mohfeedback@gov.ky. The consultation period ends on the 30th of November.
Okay.
And at which time we'll collate all the feedback, put them together, and take it forward
go through all the steps Nick spoke about.
Absolutely. So keep them coming.
Okay, excellent. So right now it's basically that education portion. We're trying to have people understand what really is going on with the Pharmacy Bill 2023. You did speak, Nick, about the current legislation shows that Cayman is not currently up to the international standards for pharmacies. I think you said a little bit about how we're behind, but what risks does an outdated pharmacy law pose?
Ultimately, it means that patients don't get the oversight of their medicines. They might not get the right quality of medicine. They might not even get something which is the medicine they think they're getting. There are not the checks and safeguards in the system to make sure that medicines aren't interacting and that they're fit for purpose. And we're not using our clinicians. And that's one of the biggest dangers we have, is that people don't get the advice at the right time from the right people who are best able to do that. But there's so much going on internationally about good manufacturing practice, good distribution practice. These are again all terms that a pharmacist would understand, that guarantee the quality, the traceability, the safety, all those things that Katherine was talking about keep us safe. And so having those links, those hooks in the legislation that speak to us wanting only GMP medicines, good manufacturing, wanting only importations using good distribution practice and the like. So it just positions us where we should be, and where Caymanians would expect us to be, I hope, of saying this is best local practice to fit best international practice.
All right, Kamani, for you, well, I asked that question, but I guess for pharmacists, what risks does an outdated pharmacy law pose?
Just from a practice standpoint, knowing that I'm practicing within the law is very important. It removes this guesswork from knowing what to do when the patient is in front of me and I have my medications behind me. And I find that is something that is, as a pharmacist, is very important. I'm looking forward to meeting a new pharmacist arriving on island, or a pharmacist who, we have a couple of Caymanian pharmacists in the pipeline to come home. And I'm looking forward to being able to say to them when they say, okay, I'm very au fait with the law in the UK where I was trained. What is the law in the Cayman Islands? And we're able to take up a document and say, okay, this is the law in the Cayman Islands. So it gives that, it serves as a compass to ensure that we're practicing within the law, that we're doing the same thing that all of our other colleagues are required to do, one level playing field. So that's one thing. It also helps to know that the quality of the medications that I am dispensing, or that are being dispensed to my son, or dispensed to your children, or dispensed to you, that we can confidently dispense that medication knowing that what it says is what is contained in it, and that we're not going to be doing any harm to that patient, or any unwanted harm, or any unexpected harm, and that the efficacy of the medication is not guaranteed, but there's, it will do what it is supposed to do and not, cause any unintended effect. So for me personally, and I think I can speak for many of my colleagues, that comfort level, that confidence level in labeling that medication and discussing with that patient what to expect, and knowing that at a minimum, what that medication says it is, that is actually what it is.
Okay, now we only got a couple of minutes. I do want to get two more questions out there, but I think one of the key changes, if I remember reading correctly, was somebody like me, I believe if I have a prescription, I'm allowed to import the drug on my own. Is this correct? Did I read correctly?
It is possible to use provisions under here for importation of medicines. This is really about if you were abroad and you become unwell and we had obtained the care for you in somewhere like Florida, because we didn't have the care off island. You're getting medicines, particularly specialist medicines that might not be available on island. That you can bring those with you. And we won't take them off you at the border by saying, sorry, it's not an approved medicine, sorry, it's not dispensed in the Cayman Islands. But also it's about things like we have people who come and stay in the Cayman Islands for many months at a time, and it's about them, a continuity of care element for them. when they arrive, and gives them time to get an established with a local practice who can dispense those things. And we do know that we have a number of people who they and their families are scattered all around the Caribbean, in Jamaica, Honduras, wherever, and in that travelling, they're bringing medicines. They have their medicines. I mean, I suppose, like myself, most people have a little stock of medicine somewhere,
yes.
just in case, and that's good practice. I mean, we'd say that for hurricane season, wouldn't we?
Yep.
But it's no different any other time or
Right.
any other travel. But it's just making sure that people don't accidentally break the law, because the last thing we want to do. I mean, there's a whole section here on offences and penalties,
yes.
but actually, I'm not in the slightest bit interested in that bit. I mean, that's last resort. I mean, it's about making sure people can get on with their lives, but where we have to intervene in terms of quality and safety, we can do so. But that importation one is there just about this. You won't be in trouble.
That leads me into almost a final question here, because CBD oil is a very popular medicine that people are prescribed, and it's also over the counter in the U.S., for example. So maybe not in every single state, but it is over the counter in a majority of the states, right? So I've known of people who have prescriptions and thought that they could just bring it over. And as far as I knew, that it was still illegal to do that. Now, that makes it... This might be where it gets tricky, because I believe that could be a misuse of drug law.
Yes, absolutely.
Even though it's prescribed.
It's something that we're working on with CBC. I mean, there is people importing medicines, or essentially carrying medicines across the border for their own use, which is properly prescribed.
Yes.
That's one thing. But there's something about buying something which is a listed controlled drug under the Misuse of Drugs Act and importing it. That's a different thing. Might sound like it's a bit of a narrow difference, but it is a very significant difference. And remember, importation is for personal use, so it's limited in terms of quantity and so on. But yeah, CBD oil is only prescribable under Section 2 of the Misuse of Drugs Act. It's got to be a prescription. It should be a prescription from a Caymanian-based prescriber, and it's from a pharmacy, and any form of cannabis product is not legal in the Cayman Islands unless it's prescribed. Very different to Florida. It's not US law, it's Cayman law. It's not in the pharmacy bill, it's in a long-standing piece of legislation, as you say, the misuse of drugs law.
Okay, thank you very much. I had one more question, and that's coming in saying, in our efforts to be proactive, shouldn't we legislate for such? And I'm not sure what that exactly is pertaining to. So thank you for your question, sir, but I'm not sure if we can answer that. I think that had to do with the bill being linked to any warnings issued by the FDA or international associated bodies.
Yeah.
So I think that's where that follow-up question is coming from.
Yeah. No, I hope we answered that satisfactorily. That we keep our senses out to the intelligence and we act on it. We don't. We're not going to sit back and say to people, "Hey, didn't you read the New York Times?" If there's something that's not right about a medicine, we'll be straight out to people to tell them about it, and not only the clinical professionals. If there's something that's that significant, it's something that there's a process we call about warning and informing. Telling people what's happened, warning people about what's happened, and informing them about why that's a risk and what they must do.
Right. I feel we touched on a lot, but there's so much still to touch on about this pharmacy bill, 2023. Thank you so much for joining us this afternoon. I really appreciate having you on Talk Today. And this show will be available on YouTube, so if you do want to go back and listen and get more information, you can do so. Remember, the public consultation period ends November 30th, I believe.
Yes.
And the draft bill is online. You can check that out. Go to gov.ky, somewhere in there, and you will find it. Go to the search bill, you will find it, or just search Pharmacy Bill 2023 Cayman Islands in Google, and you should be able to find that, okay? Your input is needed and appreciated. This bill will affect every single resident in the Cayman Islands. And we're going to go to a break, and after that, we're going to have our next guest join us for Talk Today.
From boat days to beach gatherings, leave the catering to Subway. Choose from small and large sandwich platters, double meat wrap platters, and top it off with optional cookie platters for dessert. Or ask about our Subway box to go with the option of 6-inch or foot-long sandwich, 1 cookie, and 1 bag of chips. For all occasions and celebrations, let Subway focus on the food so you can focus on the fun. Visit subway.ky for catering options. Subway. Eat fresh.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I go and flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old girl.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Find your dream car with a Cayman National Vehicle Loan. Enjoy 100% financing, up to 8-year repayment, and a 7% fixed interest rate for the first 5 years. For eco-friendly cars, we'll waive your commitment fee. This only applies to new vehicles until December 31st, 2023. Call 949-8300 or email lending@caymannational.com today.
You don't sound too good there, Bobo.
Yeah, you know how it is. With the kids back in school, every other week they coming out with something, and then I catch it.
Sound like it gets you, but for real, brother, flu season is here and COVID is still around. You gotta stock up on things like medicine, vitamins, and minerals for you and the kids. You know what they say, prevention is better than cure.
At ValueMed, our pharmacists can help manage flu symptoms and provide guidance on vitamins and minerals to best support you and your family's overall health. Visit ValueMed Pharmacy on Walkers Road or Boddentown, or WhatsApp your questions and prescription refills to ValueMed on Walkers Road at 926-1662, or WhatsApp ValueMed in Boddentown at 916-5511. Live happy, live healthy with ValueMed Pharmacy.
For the Health of It, heard on Wednesdays at 7 p.m. and repeated on Saturdays at 9:30 a.m. is brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic, located in the heart of Georgetown. Visit their website at medical.ky or call 623-1000.
Radio Cayman News. Police believe a tall, slim, masked man shot the victim on the 20th.
The search for 2 people missing at sea has come to an end.
Charged with attempted murder and possession of an unlicensed firearm, received not guilty verdicts.
The biggest driver of the overtime is on the domestic side of the fire service.
Radio Cayman. Your voice, your choice for today's biggest news.
Did you know that in an event of a hurricane, water designated for the purposes of drinking, cooking, and bathing must be disinfected before use? Water may be disinfected by boiling or through the use of chlorine bleach. To disinfect through boiling, simply leave the water on the fire 1 minute after it begins to boil. To disinfect with bleach, add 3 ounces of chlorine bleach to every 1,000 gallons of water. If you're not able to smell the bleach in the water after 30 minutes, then add half of the amount of bleach that was added during the initial application. Recheck the water after 15 minutes to ensure there is residual bleach smell. A residual bleach smell is an indicator that the water has been properly disinfected. For more hurricane food safety tips, visit the DEH website, www.gov.ky/DEH.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
Good afternoon and welcome back to Talk Today. I'm Kathy Miller, filling in for Sterling Dwayne Ebanks this afternoon. And in this segment of Talk Today, I'm welcoming from the Health Practice Commission. We have a number of people and also some representatives from the Department of Commerce and Investment. We're discussing the new procedures and how the HPC and the DCI are working together to streamline the process for those registering a business related to a healthcare field. Okay, this afternoon in studio, I have with me Dr. Alexandra Bodden, chairperson for CPAM, which is the Council for Professions Allied with Medicine. We also have Dr. Carleen Vassell-Webb, Deputy Director of DHRS and Registrar. You got to tell me what DHRS is because I forgot the acronym already. You can say that into the mic.
Okay. Okay. The DHRS is Department of Health Regulatory Services.
Thank you, Dr. Carleen. We also have Dr. Marzuka, chairperson with the HPC. Good afternoon. And we have Charmaine Dalhouse Morgan with the Department of Commerce and Investment, along with Simone Morgan from the DCI as well. So thank you everybody for joining me. And we're just going to kick it off with some of the points that Dr. Alexandra Bodden had sent to me. So you can give me a bit of a brief background after that intro that I just gave on exactly what we're doing here with this whole streamlining process.
We've got a couple of changes coming up with HPC, moving online and trying to streamline our process within ourselves at HPC through the DHRS. We've also been working closely with DCI as well. So we thought that we would just come on to talk about how it's going to work. So if someone's opening a new business and it's anything that's healthcare related and one of the professions that we manage, then what DCI is going to do is to ask you to come across to us. So we'll talk a bit more about that, how DCI and HPC are working together. So so that way when people are applying for a business, then they'll have an idea of what to expect.
Okay, so is the fact right now that if I was to open like a health-related business, I'd have to go to the HPC now to get approval?
Right.
Before I get my business license from the DCI?
So if it is something that is regulated by us, so at HPC is the Health Practice Commission, they manage facilities, and then there's also the councils that manage the professionals. So if it's something that you need a CPAM license for, then you will be a healthcare facility and you'll have to register with your council, which might be CPAM, we're Allied Health, it might be the Pharmacy Council, it might be the Medical Dental Council, or it might be Nursing Midwifery Council. So if you have a healthcare professional that's going to be employed and it's going to be a healthcare facility, you'll register with us. There are some other businesses that are related that might have like retail involved, and so that's going to be business, and that will go through DCI. But I'd say there's no wrong way to start. If you go to DCI and it's something that we're responsible for, they'll let you know you need to come talk to us.
Okay.
For us to review, either we'll tell you which applications you need to fill out and what you need to do, or if it's something that's not included under the professions that we manage and it's not a healthcare facility, then we'll give you a letter like that as well to return to DCI.
Okay. So. All right. Anybody else want to add to what Dr. Bodden said? Nope.
Yeah. Well, I think a lot of questions have come up, and so I think it's just to let people know that we're kind of talking. It's, I think before some people go to HPC, some people go to DCI, and we're not really sure who goes where. So there's no wrong way to start. We can, if it is anything healthcare related, it will be us involved in some capacity, and sometimes it will be us and DCI, and that's important to know as well. So even if it's if you're like say psychologist and you have a healthcare facility, you can operate and provide the professional services with the HPC and CPAM license. But if I'm going to be selling things, then I need a retail license as well, which would fall within the normal TBL, the process most people know.
Okay, yes. So what changes can we expect to see in the application process for the HPC with the new eGov initiative?
That's exciting.
Yeah, so as a department, our vision is to move forward to an online process which would facilitate a more efficient way of delivering our services. So we are looking forward to these changes. We know it will be beneficial to our clients, and we know that they would appreciate not having to come to the customer service kiosk all the time to drop off their application. So what we're hoping to achieve eventually, once this system is underway or implemented, is that practitioners will be able to apply online for their registration process, or even to renew their application. So it would decrease the need to come to the customer service kiosk, and it will create a more efficient way in delivering our services. And we hope that we'll have more satisfied clients in the long run.
Okay, because I know right now with the DCI, you don't necessarily have to, but I believe that is one of the options is to go online and fill out to either renew or to get a new trade and business license, correct?
Yes, that's correct.
And it's a pretty easy, seamless process. I've been through it. I think it's great. If there's questions, I found the DCI to be very, very helpful. I really think you're the best government department, really, when it comes down to it, you know.
Not in front of the others, Kathy. Not in front of the others.
Well, you know, it's true. You won some awards for it too. But from my experience, not only just at Radio Cayman, but personally, it's a very great department with a lot of help that people will get, and it's very important to Cayman, right? So, what are your thoughts in I guess streamlining this process? How does DCI make this a lot easier for people?
Yes, our online services, like you said, you can come and you can submit for a new license or renew. If there are any issues, we recommend that you come to the counter to submit if you're unable to use the online. But we've made it very easy. It's very user friendly. You can call us. You can send us an email if you have any issues, and we'll get back to you.
Okay. If somebody wants to open like a beauty salon, or I want to say even a medical day spa, because there's spas and then there's medical day spas. What are the processes that they would need to go through in obtaining either a TBL or an HBC license?
So I think that there's a lot that goes into that question, and so when that comes up, generally if someone goes into to DCI, it would come back to us. So CPAM actually manages a lot of different professions, and so if it's something that we manage, we would let you know what you would need to apply for, because there's going to be different caveats for the different professions that are there. Some people are beauty therapists that don't require licensing from us, but others that are medical allied health professionals, then they will require licensing. So anyone who is opening up a beauty salon, massage parlors, especially medical day spa, there's a lot of our professions that might be working there. Ours, CPAM, as the chairperson for CPAM, we have many professions that we manage, and that comes with the medical aesthetics. There's a couple different professions in there. So come and talk to us. There's some different technicalities that come with it, but that's our area, and we're happy to help. So anyone that does have questions or is looking to it, be mindful that when you apply to DCI, they may ask you to come and talk to us. I think that's going to be anything that's medical or health related, then that's going to come over. And there's some things that come up that are not directly related to us. We'll give you a letter, say, nope, don't need us for that. If it is something that you do need licensing for, then so we still have the help desk, and I would have to say I think that most of our compliance officers are actually very helpful too. We're looking forward to going online, but in the meantime, you come in and we'll let you know which applications you need and what the process would look like. Because a lot of times you start you could go ahead and license the professionals that will be working there as well as the healthcare facilities. So there's actually two different processes that you'd be looking at.
I know some instances of some spas, so not the medical day spas, but like little beauty spas that us ladies will frequent. Mm-hmm. And for example, and I'm not saying this is happening in DCI, so don't get the enforcement out there as yet. But in the occasion where, let's say it's a lash spot, and ladies are going to get their eyelashes done, the eyelash extension craze that's out there. And then they hire somebody to come in and do injections, but they haven't changed. And by injections, I mean for cosmetic facial injections. At that point, should they have previously, prior to even hiring somebody that's going to be doing something like that, because that's more of a, how would I say it, Dr. Marzuka? That's more, you need to be very much a professional to do that, a licensed, registered.
Right. So I think that's the major difference. When you have spas that are medical grade, mm-hmm. you would expect a certain level of compliance across the medical professions.
Yes.
Whereas when you have a beauty spa, it would not necessarily have that grade of expertise. And the difference is important because the person would not expect to get certain things done that would not be, allowed by that individual, that they should be carrying out injections when they're doing basic beauty therapy, eyelashes, facials. So there's so much this today really for cosmetics in terms of people doing application of, whether it be some sort of plasma or creams on the face. Most of that would be the remit of, the regular spas. But when it comes to injections, providing various types of fillers and stuff, that should be done by the expert. So that will not be a technician type person. You would be expecting a professional who's either with the CPAM or with the Medical and Dental Council.
Does that expert also need to be licensed to practice that in the Cayman
Absolutely,
Islands?
absolutely.
Okay, so there's a few more steps going on.
Well, yeah, that's paramount. So what you have at DCI is that you have a fairly intricate system already put in place where they have to ascertain that the individuals are of a credible level, they have good background checks, and they have the financial wherewithal to provide the infrastructure that application requires. Beyond that, they then ask us for assistance and guidance as to the medical expertise that is in that particular salon or beauty spa that is supposed to be medical grade, that individual would be the correct professional for that spa. So that's probably when they would then give a referral to the HPC.
Okay. Now, let's say none of this stuff happened that Dr. Marzuka had just mentioned, right? Because that's doing things by the book, properly doing things. Hopefully we would want people to do that. And now let's say I own this lash spot and I hire somebody to do injections. But I myself don't know that, I should have gotten them licensed, or they should be licensed to practice this in the Cayman Islands. It's just a service that I'm now offering. From the DCI's point of view, and particularly enforcement, Ms. Charmaine, what are your steps in learning that this possibly is happening at the spot that I own, at the beauty spot that I own?
Well, first I'll let you know we're going to know, because somebody's going to say it to us. Once it comes to us, then we will reach out to HPC to let them know we have this report and we need their assistance, and they'll pass it on to the proper area. And you probably will get called in to find out what is happening, what kind of services are you providing, because when you initially do a trade and business application, you do not go into full details of all of the services that you're providing. But as I say, once enforcement gets the information, we reach out to HPC because we communicate and we collaborate with them on a regular basis now.
Right. Is there any, leeway in the sense of a person might have made a mistake or didn't amend their trade and business license? You're looking at me like there's no way.
Sorry, ignorance of the law is no excuse.
It could be an alternate truth.
At DCI, we do not advocate on just enforcement. We want to guide you in the proper direction. Hence why we will reach out to our counterparts and have you go and speak with them. But if you are very stubborn in taking the advice, then we have to do our next best.
We want to see you compliant.
We want to see you compliant.
Yes, so we'll help you out and we'll direct you in the right direction to become compliant. But if not, like Charmaine says, we'll go down that road.
A bit more of a crack of the whip at that point.
Yes.
But I like that. So there is the opportunity will allow you to perhaps fix what you've done wrong here. We want to see you succeed, but if you don't also listen to our guidance and what the laws are, then there's going to be some repercussions.
Yes.
Okay. There's a question that did come in. An entity that is seeking to offer medical services that is not majority Caymanian owned and controlled will require a local company control license. Can you discuss that process with the HPC registration and then the application to the Trade and Business Board? That seems a little confusing.
So licenses that require a local company control license, those are businesses that are not majority Caymanian owned, so they're not 60% Caymanian owned. And in the medical situation, if we do see a facility coming in and applying for that type of license, we first direct them to HPC to find out if they need to be licensed with them. So we won't grant it until we hear from HPC. So we do work hand in hand together.
HPC, what's your thoughts on that question that I had posed there to discuss the process?
Well, there are various processes for DCI. So it would involve perhaps something that would be not available at this time, So they would be providing some sort of input to the infrastructure, the local medical community. And if that is verified, then we would then sit down to discuss the realms of the professionals that are involved. So whether it's medical, nursing, CPAM, whatever they required, we would then assist from that standpoint. But in terms of the verification of that particular service, because when you're applying for a local controlled license, you're saying that you're providing something that is not available locally, and there's nobody locally that's the majority ownership. So there are many steps in the process. So those have to be verified clearly. Because if somebody is not, following the right steps, I think most of the issue would be dealt with by DCI. Right. So we'd be given the input from the expertise that's used at that facility. So we'd give the provision of, services that are rendered and if they have the qualifications. But DCI would have to then make the decision if that is a local, I guess, worthwhile opportunity.
And perhaps, Charmaine, I have a small ignorance of the law because I don't I don't fully remember about the local companies law when it comes to local company control license. So when it comes to a business that's not majority Caymanian owned, because I thought most business or all businesses have to be 60% owned by Caymanian. So could you give examples in Cayman where we have those businesses? You don't have to, or perhaps you don't have to say the exact business name, but industry-wise.
So, like I mentioned before, those are businesses that are not majority Caymanian controlled, where they have the Caymanian owns and controls 60% of the licensing. But we do see more of those businesses, like say in the hotel, real estate area sector, and in the medical sector as well.
Okay, hotels understandable.
Those licenses are.
Real estate's not completely understandable to me. Why that wouldn't be 60% Caymanian owned, but hey, that's not my
it's
remit.
More along the high end real estate. So like I mentioned before, like hotels and stands.
Okay, and I have I have thoughts of that. Okay, I'm signaling that we have to go to a commercial break. We missed our earlier break because I know I got you guys in here a little later for the interview, so I apologize. But we're going to go to a commercial break right now, and then we'll hit the 2 p.m. news. I think we might have another commercial break after that, and then we will be back to wrap up the interview.
You know, as a little girl, I dreamt of traveling to faraway places and foreign lands. I tell you what though, no more dreaming. I'm going flying with Cayman Airways. How blessed are we in the Cayman Islands to have a very own national airline? Girl, you can fly to so many international destinations without the hassle of connecting flights. On top of Jamaica, Cuba, and Honduras, you got non-stop flights from Cayman to New York, Miami, Tampa, and even Denver, Los Angeles, Panama, and child, they now have Barbados. Going to be a little cafe con leche and Hollywood Squares for this old gal.
Make your travel dreams come true with Cayman Airways, offering non-stop flights for non-stop adventures in Panama, LA, and many more places in between. For details and to book, call 949-2311, contact a travel agent, or visit CaymanAirways.com.
Discover your dream home with Cayman National's home loan. Get up to 95% financing, repayment up to 40 years, and just a 0.5% commitment fee. Your interest rate? Depending on your risk factors, it'll be fixed or variable. Plus, you get a pre-approved credit card. This is a limited time offer. Dial 949-8300 or email lending@caymannational.com today.
Can you imagine your home completely organized? At Brand Source Custom Closets, we can. We specialize in designing and building custom closets and storage units for any room in your home, including the garage. With tailored designs and custom LED lighting solutions to fit your lifestyle and budget, our Custom Closets expert is committed to enhancing the value of your home with a solution that is uniquely yours. Visit our showroom or call 623-6774 to schedule a no-obligation appointment with our design expert. Brand Source Custom Closets, 209 Dorsey Drive, Industrial Park.
The offices of dermatologist Dr. Wayne Porter will be taking appointments from October 23rd through the 28th at his Crew Road Clinic. Appointment slots are limited. Whether you're seeking advanced skincare, Botox, filler, cosmetic skin enhancements, or simply looking to reduce wrinkles, Dr. Porter offers a full-service dermatology and dermatological surgery practice. For more information, email dr.porterkman@gmail.com or call 946-9020 to book your appointment today. That is 946-9020.
The 7:20 a.m. Weather Report, Monday through Fridays, is proudly sponsored by Flow Business. Flow, making Cayman fiber fast.
Radio Cayman, the voice, the heart, the soul of the Cayman Islands.
Today's biggest news.
Radio Cayman, your voice, your choice.
Local, regional, international. This is headlines from Radio Cayman's newsroom.
Today's biggest news.
New Royal Cayman Islands Police Commissioner Kurt Walton is hosting a series of district meetings beginning in Cayman Brac tomorrow, followed by another on Wednesday. The Brac meeting will be held at the Multipurpose Hall from 6 to 8 p.m. In Little Cayman, it's more of a meet and greet at Little Cayman Beach Resort from 10 a.m. to noon. Then the Commissioner heads back to Grand Cayman for a meeting in Boddentown, with additional meetings through the 9th of November at various districts. We'll have the details on the bulletin board and our website at radiocayman.gov.ky. Good afternoon, I'm Dion Anglin with your headlines. In news elsewhere, an off-duty pilot has been charged with 83 counts of attempted murder after he allegedly tried to crash a passenger jet during a flight on Sunday night. The suspect was sitting on the cockpit of an Alaska Airlines flight behind the captain and the first officer, according to an airline statement. A police booking document named the suspect as 44-year-old Joseph David Emerson. The flight was on his way from Everett, Washington to San Francisco, California, with 80 passengers aboard. It was diverted to Portland, Oregon, and the suspect was subdued without incident. And billionaires should face a minimum tax rate, according to a report which found some of the world's mega wealthy are paying little to no tax. The EU Tax Observatory said most people pay a higher rate than the super rich, who it said are able to use complex business structures for avoidance. It suggested a minimum 2% tax rate on billionaires' global wealth, which would raise $250 billion a year. There are around 2,500 billionaires with a combined wealth of $13 trillion. That's a wrap of your headlines. I'm Dion Anglin.
Today's biggest news.
Radio Cayman, your voice, your choice.
Local, regional, international. This is headlines from Radio Cayman's newsroom.
Today's biggest news.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
Welcome back to Talk Today. I'm Kathy Miller, filling in for Sterling Dwayne Ebanks, and in studio I have representatives of the Department of Commerce and Investment, my favorite department in government, aside from Radio Cayman, of course. We have Charmaine Dullhouse, and we have Simone Dullhouse-Morgan, and we have Simone Morgan from the DCI. And also in studio, I have Dr. Marzuka, chairperson of the Health Practice Commission, Dr. Carleen Vassell-Webb, deputy director of the DHRS and registrar, and Dr. Alexandra Bodden. Our listeners should be very familiar with her as well. She's here in capacity as the chairperson of CPAM, the Council for Professions Allied with Medicine. Now, we touched on some of the questions I had in regards to if you're looking to set up a business that might require you to go to the Health Practice Commission, and then the guidance that you might need from the DCI or vice versa. But I guess in summary, what would you really want people to know if you're starting a business like this or looking to amend a business that might need the guidance of the HPC, and also for just a general person like me going into a business that is offering services that do have some bit of a medical connection to it?
Well, I would say start early. You know, all of us are here to provide information. You know, as DCI said, what we prefer is not to catch people, but to help people understand and to follow suit and follow the procedures. So I'd say reach out early. Reach out to us. This is what I'm planning. Is this something that I need to be registered with? reach out to DCI. Is this something that I'm able to do with just a TBL? So, if you have those conversations early, and then you can make your plans. What's difficult is when you're, ready to go and you reach out for the TBL and they're like, oh, you have to call HPC first. Then you have to come back over and then start that process. So as you're getting into it, anyone who's doing anything related to health, reach out to us, find out if it's a profession that needs regulation. If so, we can direct you to the correct process. If not, we'll give you a letter saying that too. And then you're able to work with the ladies over at DCI. So I would say start early. The Health Practice Act and regulations are all available online. You're able to see which professions are managed. And so if there's something that isn't there, you can reach out to us as well. So if it's there, we're going to tell you that that's something that you're going to need a license from us, from the commission, as well as from one of the councils. But we can tell you which one and how all of that works. All of it's available on the website as well, which is dhrs.gov.ky. Yeah, okay. But all the forms are there. Everything you need for any of the applications that you'll be doing. So, and plan ahead. With the councils and the commission only meet once a month generally. So, find out when the meeting is, and then you can plan your paperwork as well, because if you are going to need something from us, you're going to need that before DCI. So Correct. Go ahead, have a look, have a walkthrough. If you're not sure about anything, we have people at our help desk from 10 to 2 each day, or give them a call. And then you can get all your questions answered and then plan for it.
Okay. Yeah. Now, Dr. Mazuka, I know you said a lot on the break as well, especially if you're...
I think it probably is important to simplify things. From a local perspective, if the person is pretty sure that they have a health profession that they're trying to create their facility, then I think probably straightforward go to the HPC at that point in time. If you are a foreign entity, I think the best starting point would be the DCI. So that would be the easiest step forward, and then if DCI needs any assistance, they'll reach out to the HPC, and vice versa for the local person. If we think there is a DNB license required, then we'll refer back over to DCI. As far as the facilities, I think expectations on the public should be looking at whenever they attend, in particular spas, I suppose, are the most confusing. And those, if there is any intention to receive some sort of medical type treatment, you should look out for the medical facility certification as well as the practitioners. And those practitioners would have a certification that should be easily visible when you enter the facility. And if it's not, then more than likely you're not in a medical facility, at which point in time you can contact DCI directly.
And that's required by law, correct, to have these certifications and your trade and business license?
Yes.
Present.
And our law is that once you get a trade and business license, it has to be displayed.
Right.
Yeah. And it's the same for HPC as well. It has to be displayed.
Right. So if the permission came from the HPC to have this business, which had to be streamlined with the DCI, you must have that approval from the HPC displayed as well.
Yes.
Right.
Very important.
And any professional you work with should be able to share their credentials and their licensing as well. That's something that any of us should be able to provide easily and are obligated to discuss if there's concerns or questions.
Dr. Hassan comes to mind, but anyways, that's a whole other conversation.
And
Dr.
all
Marzuka just hit his head.
Licenses say that it must be displayed. That is clearly on the licenses.
Yes, I do remember.
Because we do have a
clear.
penalty in law that they can be ticketed if they're not displayed.
Right. I remember being in a business and they were saying, okay, we have to, they hadn't put their new one up, the new one that got approved. We have to yearly get these approved, correct? And it was just a concern, we have to get the new one up. And I remembered being like, okay. Like I appreciated that professionalism, not only just to make sure that they were following the law, but also ensuring for their clients that are in that spa, it was a spa, that they know that this is an approved business. We are following the laws, and we are up to date with everything. It's really important. I know in Cayman years ago we had some cases of, I think, somebody that was practicing injections and wasn't licensed, wasn't allowed anything. So it just, did you know this person, Dr. Marzuka?
No, I didn't know them.
But do you recall this?
I did. I think I was actually at the then HPB when we started that process. So that's how far back it was. That's before we split off into councils. Mm-hmm. So that's many, many years ago.
If there are any concerns, we have a complaint form, so any concerns that come up, you can fill it out and submit it to HPC or the councils, and we'll look into it and give a response. So that's available on that same website as well.
Is that an anonymous way to? It's hard to online anonymously submit a complaint.
We do ask for the person's name so that we are aware of who's there and we're able to follow up with them.
Okay.
But we can follow up and we'll keep it private as long as we can.
Okay.
So.
Okay.
Yeah. All that's outlined in the form, and you're also welcome to give us any calls if you have any concerns or questions about the forms.
Okay, excellent.
And we can help.
Yeah, we cannot emphasize that enough. If you have any questions, any concerns, reach out to us. We're there to assist, and we know our processes can be complex at times.
But it's safeguarding, really.
Yeah. But we have to ensure we're following the mandates of the legislation, and a lot of times that can create some frustration and anxiety. But we are there to assist. If you have any questions at all, just reach out to us. You can email us. You can come to us at the customer service kiosk as well. We're more than happy to sit with you and go over any concerns that you may have and try to guide you through the process.
And respectfully, it might be tedious for some to want to go through all these steps and fill out these forms and whatnot, but it's really such a large part of running your business and running it legally.
And it's not just about running a business. It's also when we are in the business of healthcare.
Yes.
We have to look at it from the perspective of the patients, and our mandate is to protect the patients, the safety of the public. And if for us to do that, we have to make sure that the regulations, the legislation is being complied with.
Okay.
But as I said, we are there to assist.
Yes,
so.
absolutely.
And like DCI would rather help you comply than catch you.
Right.
So please do reach out if anyone has any questions.
And this, I'm not sure if anybody will be able to answer this, but if somebody was coming to apply and perhaps they had in something in a health practice, and perhaps in another jurisdiction they have cases against them, fraudulent cases against them in particular healthcare practices. Is there any, I guess, kind of research that how heavy does the research going into the person who is applying, who is that practitioner that is applying? Is there any sort of a kind of research or background done on the people that are looking to establish these businesses?
So we do that on the DCI end. We have a compliance team who, when an application is submitted and is during review, we do go into the background of all individuals involved in the business. So we go right all the way, we ask questions, and we go all the way down to the ultimate beneficial owner of the business. And once we do get a hit on something, we go back out to the client and ask them to address the query or the issue.
Okay, thank you.
And I think from the HPC perspective, even if DCI do the usual thorough job that they do, once it's a professional that comes across, we would again research it. Not that there's any doubt into their background checks, but we'd research again and probably reach out to the areas in which the person designated that they worked. So on the form, even if you work, for example, in Minnesota, and you had a fraudulent case there and you applied to us from Florida with your Florida license, you do sign off that it's fraud, and it does carry quite a penalty. So it would probably not be a good idea to do that, because at some point in time we're going to come across that issue with Minnesota, and at that point in time you're going to have a big problem. So it probably is best if you present all your issues, because there are some issues that were a legal challenge, but turns out that the matter was resolved, and you probably don't really have as much a problem as it was initially thought, and you would not be prevented from practice once there was no harm to the public or any deliberate attempt to do some fraudulent business. So I think that's the important thing, because I think people believe that if they perhaps try to do an application here because they have an issue somewhere else, that we will not find out. Sooner or later it will come. If not in the initial go-around, on the second go-around. And either way, the penalties here are very, very stiff, and I probably don't suggest that be something you want to attempt.
Right. Well, no, thank you for clearing that up. very specific reason that I asked that question, but that's for me to know. So thank you for joining us, for giving your explanations, for giving some insight. And again, if you want to reach out to the Health Practice Commission, you can do so. Dr. Bodden, would you like to? Or you're for C-SPAN, so you got to...
Oh, dhrs.gov.ky has all the councils and the commission and all the forms that I've talked about as well. For first-time applications for any of the councils or the commission, the complaints form is there as well as guidelines for completing the applications too.
Okay. And with the DCI, it's dci.gov.ky?
Well, you can reach out to us by phone if you like. Our main number is 945-0943. And you can email us at info@dci.gov.ky.
And they actually answer the phone there, guys. I can tell you that. So, again, thank you so much for joining us on Talk Today this afternoon. I appreciate having you. And we're going to go to a commercial break, and then we'll have some open line for the rest of the show.
Thank you.
And that's why at Subway, we're introducing the new Boneless Hot Sub. Say what? The premium sub brings new ingredients like spicy breaded boneless chicken, French's crispy fried onions, and buffalo wing sauce, bringing a zesty and flavorful experience with every bite. Add some of your favorite veggies, cheese, and ranch sauce of your choice of freshly baked bread for the ultimate boneless hot sub. For a little spice in your life, try the new boneless hot sub from Subway.
So good and tasty.
And make it a meal with a drink and chips or cookies. Subway. Eat fresh.
Find your dream car with a Cayman National Vehicle Loan. Enjoy 100% financing, up to 8-year repayment, and a 7% fixed interest rate for the first 5 years. For eco-friendly cars, we'll waive your commitment fee. This only applies to new vehicles until December 31st, 2023. Call 949-8300 or email lending@caymannational.com today.
Freedom, Cayman Brack. Freedom, Little Cayman. Soft breezes, blue waters, no traffic. Unwind and rejuvenate your mind, body, and soul. Sister Island Staycations, a taste of freedom. Discover all that our sister islands have to offer.
At Doctors Hospital, we know life happens, and usually when you least expect it. So when unexpected medical issues arise, you need quality care close to home. Located in the heart of Georgetown, our accomplished team of physicians and medical staff treat minor urgent conditions such as migraines, chest and abdominal pain, shortness of breath, burns, broken bones, open wounds, and more. 24 hours, 7 days a week with no appointment necessary. Peace of mind is important when life happens. At Doctors Hospital, we're always here just for you. Need to speak to someone? Call 949-6066.
I love Pizza Boat. It's yummy. It has my two favorite things combined, cheese and boats. Pizza Boat makes pizza way more fun.
Hop on board the Pizza Boat Express. Kids, now Pizza Boat makes pizza even more fun. Lunch or dinner, let Pizza Boat bring the fun. Pizza Boat, a Cayman twist to pizza, bringing fusion ingredients from all over the globe to give you locally inspired fresh pizzas all day, every day. Pizza Boat, now open in Queens Court on West Bay Road. Pick up or delivery 949-0000 or order online www.pizzaboat.ky. 89.9 Radio Cayman helps you to weather the storm during this hurricane season.
One of the most crucial elements of hurricane preparedness is storm awareness. During the season, it is of utmost importance to pay attention to the latest local weather forecast, as hurricanes do not suddenly form or strike. There are various methods of advanced notification. Utilizing such may be the difference between a favorable outcome and disaster. Both television and radio serve as excellent mediums with up-to-the-minute storm path information in the wake of a hurricane. Another method of tracking a hurricane may be only arm's length away. Your smartphone or tablet can be your most valuable tool before, during, and after a storm, providing countless numbers of apps with crucial hurricane information. Many apps allow you to track storms with moving radar and satellite imagery, plus offer alerts, current conditions, forecasts, advisories, and even video.
This hurricane preparedness tip was brought to you by your community radio station, Radio Cayman, 89.9 FM.
Listen
to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
Good afternoon. Welcome back to Talk Today. I'm Kathy Miller, and we're coming up to round off the show. We only got about 10 minutes left, and I've gotten some WhatsApp messages that have come in today, but I haven't gotten any calls. So if anybody does want to make a call, you have some time. 949-8037 or 949-6990. You can also WhatsApp message or WhatsApp call us at 925-3261. I just wrapped up with the Health Practice Commission and representatives from the Department of Commerce and Investment. We were discussing new procedures and how the HPC and the DCI are working together to streamline the process for those registering a business related to a healthcare field. And we talked a little bit about those who are looking to get a health and wellness trade and business license. This affects people who are in massage therapy, beauty salons, laser technicians, clinics. It's so much out there. Anybody might have a retail store that is selling health-related products. You might need to liaise with the HPC as well as with the DCI, and they'll let you know, hey, you do need some permissions from us. You do need to follow these certain standards. You do need to make sure that your practitioners are licensed and they're licensed to work in the Cayman Islands. So that is what we were discussing, and if you do have questions, I believe it's the DHRS that you can get in touch with. Ooh, I didn't write down the website, my bad, but you can look that up, Google it, Department of Health and Regulatory Services. And of course, the Department of Commerce and Investment, dci.gov.ky, if you're looking to get in touch with them and if you have questions. Both sides were saying plan ahead, because if it is the case where you need some permission from the HPC, they only meet once a month. And so let's say you need to get a trade and business license in next week, but the HPC meets 3 weeks from now. And you're going to need their permission for your trade and business license. You want to be able to plan ahead and make sure you're getting the proper guidance and whatnot. Otherwise, your license could be held up or rejected, and you don't want to go through that process. Earlier in the show, I did have the Chief Medical Officer, Dr. Nick Gent, and the Chair of the Pharmacy Council, Mr. Kimani Blackwood, in to discuss the Draft Pharmacy Bill 2023. Joining them as well was Janet Flynn, Senior Policy Advisor in the Ministry of Health and Wellness, and we were talking about what some of those key updates and changes of the Pharmacy Bill 2023 are. Right now, the Pharmacy Bill is in its public consultation period. You can go to gov.ky, search for Pharmacy Bill 2023 Cayman Islands. You can Google that and find it. The draft bill is there. Read through it. It's about 32 or 30 pages. And it's really broken up into, I think it's about 6 parts. I made some notes on this. So it is about, of course my parts aren't in, my notes aren't in order. But it is broken up into about 6 parts, and it has 43 different clauses in it. And some of the main changes to the pharmacy bill talk about who can prescribe a medicine. And you have to be a registered practitioner in the Cayman Islands to do so. Now that means even pharmacists are allowed to prescribe medicine. So when we say registered practitioner, you have to be registered with the, I forget what it's called now, and the whole name is escaping me. But anyways, you have to be a registered practitioner in order to be able to prescribe medicine. So that kind of changes things a little bit. It used to be just doctors, vets, and I think there was one other category that could prescribe medicine. This makes it more beneficial to residents, to the people of the Cayman Islands, because this means that you do not always have to go and see your specialist doctor or a GP doctor if you have, you're experiencing pain or you have an illness or any ailments going on. You don't have to necessarily now make a doctor's appointment to go to get a prescription. If you have a relationship with your pharmacist, now is a great time to begin one. You can go straight to your pharmacist. You can describe your symptoms, and they, under this new bill, the Pharmacy Bill 2023, you will be able to go to your pharmacist as long as they are a registered practitioner, and I'm sure they are if they're a pharmacist in the Cayman Islands, working for one of the reputable pharmacies. You can go to them to get prescriptions, and this alleviates a whole lot of time spent at the doctor's office, waiting a long time for appointments. And oftentimes I know that when we can go see a doctor, a lot of the time we're dismissed in what our symptoms are, or, it can be somewhat of a very quick 5-minute kind of meeting, 10-minute kind of meeting with them, and it's almost a little bit dismissive in the interaction, and that's just because doctors have so many patients that they need to see in the day. So it might seem like, okay, they didn't really take the time, they didn't really listen, and are they really catching all my symptoms here? But if you're able to go to a pharmacist, you're able to save a lot more time. You don't necessarily have to make an appointment to see a pharmacist. Your pharmacist knows you. Your pharmacist has seen so many different prescriptions come up for you over the years, and they're able to say, hey, this doctor didn't catch that this medicine might interact with another one that you have been taking or that you are taking, and perhaps this is a little better way for you to go. So they are able to lead you down a better path as well. So I would say that's a really key benefit to the Pharmacy Bill 2023. Another key feature of the Pharmacy Bill was talking about Cabinet's use in an emergency medicine to be used. It's considered a non-approved medicine because if it was approved, then Cabinet wouldn't need to have this sort of directive. So for non-approved medicines, Cabinet does have the ability to have emergency medicines approved for dissemination in the Cayman Islands. So that's another big part of the Pharmacy Bill that we're looking at. And if some of our listeners remember when Kaimani Blackwood, representing the Pharmacy Council, was speaking, having an updated Pharmacy Bill will also help protect pharmacists in how they are dispensing, how they are storing and controlling the medicines that are available in the Cayman Islands. When we have an outdated bill from about 44 years ago, which I understand so many times it's been brought up to go through legislative changes, but for whatever reasons, the ball's always dropped. So here we are some 44 years later. Understandably, the pharmacists were working a little bit in a gray area, knowing that, hey, we are not quite up to international standards and we need to do, we really need to pull our socks up and we really need to be able to provide people with the best care available in Cayman. And to have an updated pharmacy bill that provides more of a regulatory framework in how pharmacists also operate, I think that's so important. It not only protects the pharmacists in their profession, but also the patient that is being prescribed the medicine. So a couple things to look at with the pharmacy bill. The CBD oil that people have an interest in, that is still not something that will be over the counter, at least not until the legislative changes can happen with the drug laws. So we got to look at that maybe a little further down the line. But the bill, the Pharmacy Bill 2023, does address the fact that if you are prescribed something in the U.S. and it is not necessarily on the list of approved medicines in the Cayman Islands, but let's say you sought treatment in Florida for something and were prescribed something and need to return back to the Cayman Islands, as a resident here, they can make exceptions that, yes, you can import this medicine to the Cayman Islands that may not be readily available in Cayman. So there's definitely some key changes to the Pharmacy Bill 2023. And again, that consultation period is open until November 30th. You'll be able to catch the replay of our interview on YouTube. Just search Radio Cayman on YouTube and you'll be able to get today's show and hopefully have some of your questions answered. You can also send your feedback or questions to mohfeedback@gov.ky. So you'll be reaching out to the Ministry of Health and Wellness with your feedback on the draft bill, the Pharmacy Bill 2023. Have a read through it. It's important that you know what these changes are, how you as a patient, as a consumer of medicine, will be better protected, and how the government has certain rights, or will under cabinet, to bring in what is considered at this time unapproved medicines to Cayman for emergency occasions. And, we had that with COVID-19, right? So we saw how we had to go through many legislative changes in order to get a vaccine in and whatnot. So a lot of things to look at. I did touch on the fact that, man, if some medicines aren't approved in the UK, but they are approved in the US, how do we decide what we're bringing in? And the answer was, well, either or. So really they'll look here to see, okay, they'll really research and look into the medicine and see, okay, what are the issues going on? If it is market available and it's said to be market available and market ready, then that gives it justification enough to bring it to Cayman, whether it's FDA approved or not, or whether it's approved by the UK's equivalent, which is the MS something something. I forgot the acronym already, sorry. But that's important. So, and I say that because I can't relate it to medicine, but I got to look at food preservatives and food coloring. There's certain food colorings that are in a lot of candies, a lot of different food, that the FDA approves, that we have come to know that it aids to cancer. So if the FDA approves it, and we know it's a cancer-causing chemical, but the UK and Europe does not approve these chemicals, that would kind of make you wonder with medicine, okay, it's parallel to medicine. Why does one major country allow something and the other doesn't? So those are kind of the questions that I have that I think we should still kind of have a concern with when we're looking at the medicine that is being approved or not approved for availability and dissemination in the Cayman Islands. So check out the Pharmacy Bill 2023. Google that. You got until the end of November to get your thoughts and feedback in. And again, that email address is mohfeedback@gov.ky. Thank you for joining me today on Talk Today. Tomorrow you're going to be with Oric Connor. He'll be taking you through the afternoon, and that's about it. Have a great afternoon, Cayman. Thanks for joining.
Talk Today is brought to you by Subway, open 24 hours in Countryside, Anderson Square in Georgetown, and Centennial Towers in West Bay. And by the Ministry of District Administration. Explore your history, explore your land, explore your sister islands. And Cayman Airways. Call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And now, Barbados. And Digicel, Cayman's bigger, better network.